If you're looking for dermal fillers, this is the video for you. So what are dermal fillers? Well, dermal fillers are basically chains of sugars that are designed as a gel type formulation that enter under the skin to help lift and change the shape. So whether that's due to volume loss or changing the volume in your face, because maybe you haven't lost that volume, but you want to create a different shape. So you might be wondering, who can have dermal fillers? Well, anyone over the age of 18, and it doesn't matter after that what age you are, as long as you've got skin, you're healthy, and you're fit, and you're able to have a treatment, then there is no age limit after the age of 18. Do we treat anybody younger than 18? Absolutely not. And so you'd be classed as a child, and therefore, unfortunately, you would have to wait until you're 18 years old. It's just a case of anybody who is fit and well and is looking to change the shape of their face. So indications that you might think about are if you've got sagging jowls, have a little look back at old photographs. It might be that you've got a lot of volume loss on your jawline. If you've got heavy folds here, it could be that we've got volume loss here. Or it could be that you've got a lot of volume and that maybe when you're sleeping, you're seeing this crease on the side. Sometimes excess movement, and that excess movement over time combined with things like sun damage, smoking, can actually change the texture of your skin. So have a little look. Have you maybe not lost the volume, but you've got those textural changes? So it might be that we need to combine the dermal fillers with another treatment. But in terms of fillers, if we can change the shape of your face even slightly, and not necessarily to change the shape so that you're going to look different, but so that you can go back in time and look as you used to look. So you look at this photo here, you can have a little look at restoring the volume on your chin and restoring the volume on your jawline and your cheeks, just to recreate that lift that you once had. When we think about other areas that you can have, pretty much anywhere on the face and neck. So when we think about if you raise your eyebrows and you may have an indentation on the forehead, or you may have an indentation on your frown, other areas, not necessarily indentations. For example, as we lose the fat pads on our brows, having that nice firmness and lift, you might find that actually they're starting to look a bit flatter and the eyelids are coming down, so we can actually put filler on the brow. And then that gives that archway back and restores and lifts a little. And another thing that we can do is we can place filler here in the temple just to restore any hollowness. And again, looking at the cheek. Now, quite often people say, oh, well, I've got really full cheeks here. But actually, let's look back in your 20s. What were those fat pads like on the upper part and central part of your cheek? So if you find you don't have one continuous curve from the front of your nose to mouth line all the way up to this nice little fat pad that we have just under our eyes, if you've got a little dip in between, it's probably either those fat pads have changed position or that you've lost a bit of volume. And we can restore that so that that curve then becomes one nice continuous curve in these two parts where it goes up, down, and then back up again. Same goes for the jawline. So if you find you've got heaviness here to the jawline, it's not that actually maybe you've put weight on or that suddenly this becomes heavier. It's actually this section is now falling forward because we've lost the volume that's here on the jawline. And all of this we want restored so that this can be fuller again. Because if you imagine, we start to lose the fat here, but also our jawbone shrinks. So we want to restore all that volume here. And then if the volume is restored, any lines that you have across here will then pull out because, of course, the volume will look after the lines. So then we've got to look at who can't have the treatment. So we know that if you're under 18, that you can't have the treatment. We want to look at your medical history. So that's why, again, it's really important that you come in for consultation. So do you have any health issues? Are you having any investigations or tests? I think the key thing is we've got to look at how does your skin respond generally on day-to-day healing? Does it heal really well normally, or do you have poor healing response? So for example, if you have diabetes, but some people with diabetes are still really healthy, their blood sugars are really stable, and in that case, then yes, they can have treatments. But if you find that you've got leg ulcers or you've got poor circulation in your toes, it might not be a good idea for you to have treatment. So the key thing is there's no black and white at times. And the key thing is for you to come in and have an assessment with one of our practitioners, and then we can make a professional judgment as to whether or not you're going to be suitable for treatment. To give you an idea as to whether or not you think, if you're trying to think at home, oh, am I suitable? Things like, do you have infection in the area? Is the area tender or sore? Have you had treatments or have you had operations in the area that might mean that the skin is a little bit too tight? So, for example, we've had clients who have had surgery and it's okay for us to restore the volume. But there may be instances where you've had surgery and the skin is tethered really tight together and that filler can't sit underneath. So again, the key thing is for you to come in, have a consultation and get assessed by one of our medical practitioners, and we can discuss those different options with you. So you may be thinking, well, do I need to consider having dermal fillers? And the times that you want to have dermal fillers are if you've lost volume and that you want to restore it back to how it was, or that maybe you have a certain shape of your face that you want to actually change. So for example, some people have rounder faces and may want to have a more of a square jawline. Some people might have a flat chin and might want a little bit more of a curve. Some people might not like their profile, so they want certain areas to protrude a little bit more. And that includes areas of the nose, if we want to restore the volume here to give a straighter profile, or you want to make the tip of the nose lift a bit. So really, anything where shape changes, that's where dermal fillers come in. So dermal fillers are placed under the skin, and in order for them to be placed there, they need to be placed in with either a normal needle or something that we call a cannula. Now, with a cannula, they're the most amazing tools that are ever invented, and they come as a round-ended needle. Now, we do have to make a little entry hole with a normal needle, and then we remove that and place the cannula underneath. So that round-ended needle means it's so much softer for the skin, so much softer for the tissues. We're less likely to cause bruising, but it doesn't guarantee that you're not going to bruise, but that is one of the potential side effects. Now, if you do bruise and maybe you're prone to bruising, or number two, you just have a blood vessel in the area that's going to be injected, or you're taking medication that thins the blood, it's possible for that bruise to be a more severe bruise than most bruises. Now, like any bruises can last for a couple of weeks, and it takes time for your body to carry that debris, because for your body it's, the blood shouldn't be there, it's just in an area where it shouldn't be, and so your body will carry that debris away. Now, that can take time. So if you've got a special event, that's something that I really want you to consider. Other side effects associated with a normal needle and not necessarily having any product whatsoever. So itching, if you imagine, we have a little bit of a histamine response when a needle, or if you just scratch your arm on a bramble, your body will have a histamine response. So you'll get a little bit of swelling on the surface of the skin, you'll get a little bit of inflammation and maybe a little bit of itching. But that itching should not be prolonged. So it might just feel a little bit irritated for a day or two, and all of that should ease. That redness should start to ease and the tenderness will start to ease. Now, that should be there for about 48 hours, and we expect that. What we don't want is that to get worse, okay? So all those symptoms should start to get better. The good news is, if it does start to get worse, we're here for you, we're here to look after you, and we'll need to assess you to see why that is. That could be due to an infection occurring. If that happens, you'll come in and see us, you'll get seen by one of our prescribers, and we will prescribe you some antibiotics, and we'll get those from our local pharmacy for you. So normal side effects associated with an injection. So if we're breaking a little hole in the surface of the skin, so that's a mode of entry for any infection. So we'll clean the skin beforehand. If you can come in without foundation, that would be the ideal scenario. It's not the end of the world if you do come in with it. We'll clean your skin before. We just ask that you keep your skin clean for the day of your treatment and not to apply any makeup, not to pat your dogs and touch your face. So basically keeping the area nice and clean. Maybe consider changing your pillowcase for the day of your treatment so that you can then keep that area nice and clean. So if you do get any symptoms of infection whereby it would get hotter and redder and more tender after 48 hours, then you can give us a call and we'll sort you out. We'll assess you, get you some antibiotics if needed, and then we'll give you a prescription that will go to your local pharmacy and we will look after you and sort that out. Other side effects that may happen that we expect, again, from a needle. So the itching we've covered, tenderness, swelling, bruising, and the bruising, like I said, could last for a couple of weeks. Risk of infection. And then the last one is risk of blocking a vein. Actually, not the last one, there's one more after that. Risk of blocking a vein, though. Of course, our face is covered with blood vessels to help feed and nourish the skin. And what we don't want is for those blood vessels to get blocked by dermal filler, because otherwise we can't then get oxygen and nutrients to the skin. And that means there's a risk of necrosis. And that's something that we definitely don't want to happen. The good news, though, is dermal fillers can be dissolved, which means you just need to come in. We will assess you once again, make sure that there's no allergic reaction to the dissolving enzyme, and then we would dissolve that dermal filler for you. That would then allow nutrients and oxygen to flow, and your skin will return back to normal. The key thing here is to notify your practitioner, because if we don't know what the issue is, then we can't resolve it for you. So come on in as soon as you've got any issues. You just give us a call or you just turn up. We will assess you and we'll look after you. One other issue is there is the risk of what we call the Tyndall effect. So if you look at the dermal filler is actually clear. And just like the water in the sea is clear, when the sun shines on it, you'll see that the sea looks blue, and that's what we call the Tyndall effect. So it's basically light reflecting off the product, or light reflecting off the sea. If that happens, it's usually as a result of filler being too near the surface. But again, filler can be dissolved, so that's good news. However, if, let's say, you have an issue and we don't know how to manage it, we are actually members of the Aesthetic Complications Expert Group. And what that means for you is that if there are any complications that I don't know how to manage or none of my team knows how to manage, we pay for a team of experts, doctors and nurses, who can give us advice on how to look after you. So, like I said, who is the dermal filler for? So it's maybe anyone who's got volume loss. So if you want to restore the volume, so whether we've lost a little bit of volume along the jawline, this nice big fat pads that we used to have when we were younger, then we can restore that. If you've got facial hollowness, we can restore that facial hollowness here. If you just have natural indentations that you don't like, so for example, a little bump on the nose, we can restore volume here to give that straightness, or like a straightness to the jawline. And of course, we can give structural balance. So maybe you just don't like the balance that you've got. So for example, the natural youthful appearance is usually where it's narrow at the bottom and fuller at the top. So if we're fuller at the top, it lifts. So, and if you find that you've got a natural fuller jawline and you want to restore that balance, we can look at assessing you and giving you that structural change, and we can restore that balance on the upper part of the face so that it balances out any fullness that you've got on the bottom. And of course, the last thing is we can restore volume in deep lines. Now, it might be on the whole, when we restore the volume, the lines actually take care of themselves. However, there are instances where surface lines just remain, and we might need to then layer the filler with a very fine filler so it can really lift out those little hollows on the surface where we might want to just lift those out, Or for example, some people get lots of little hollow lines here, and we just need to layer it with then an additional dermal filler. However, in some circumstances, you might find that you actually, so for example, if you pull the skin tight and you can still see the line on the surface of the skin, it might be that you need to have skin treatments like microneedling or Tixel. Now, there are some instances where people talk about prevention versus restoration. Now, I would say prevention for dermal fillers are more like something like Sculptra, which technically is a dermal filler because it's going under the dermis and it's filling the skin. But something like Sculptra is a biostimulator. And I'm going to talk about that in a separate video. But briefly, I would say that that is something that would be a preventative. Dermal fillers are more about pushing volume back and restoring lost volume rather than a preventative. And so we're going to do a separate video. So do make sure you follow along so you can be notified of any new videos that come along. So it comes now down to who is going to inject you. Now, the big old debate, who can you go to? I personally think, and I know that anybody can inject dermal fillers, but this is not about whether you go to somebody because they're the right artist or they're a medical professional. You probably want somebody who is a bit of both. So you want someone who understands shape, understands the balance and the art of what looks beautiful. Like if you see someone who has created results that you don't like that balance of, it's very unlikely that those results are going to transpire into results that you want when you're having treatment. So it's really important to have a little look at your practitioner's portfolio. So that's one of the things, but don't rely on that alone, okay? So we want to make sure that you're safe too. So other things to look for, do they have emergency protocols in place? So for example, like I said, we're part of the aesthetic complications expert group. So that means that we have a portfolio of complications management policies. So we know how to look after you. And if we don't know how to look after you, we've got a team of practitioners as well, but we also have a backup of medical practitioners through the aesthetic complications group where they will help us to care for you if we don't know what to do in that instance. Then you want to think about things like, how is this clinic going to look after me if I have any issues? So maybe look at the reviews, have a little look back. And if they have negative reviews, what is that clinic's response to that negative review? Do they just ignore the review? Do they come back and say, oh yes, please let us know. Please get in touch because we want to be there to help you. So negative reviews aren't necessarily a bad thing if you can look at the reason why that's come about and how has that clinic responded. So if anything were to happen, what can your clinic do for you? Do they have a protocol in place to look after you? Do they have emergency drugs in place? Does somebody know how to use adrenaline? Does anybody know how to use a dissolving enzyme? Can they prescribe any products for you? So for example, if you need antibiotics or if you need steroids, can that person prescribe? And if they can't, that's not the end of the world, but can their prescriber see you in good time? Then I want you to look at hygiene standards in the clinic. So have a little look around. Is the place generally clean? Okay, so yes, you want to look at the floors and is there dust on the side? But I want you to look a little bit deeper than that. What are the worktops like? How are they using sterile packs? Well, are they using sterile packs at all? So where are your dermal fillers placed on the surface? So for example, I have been somewhere where the cleansing device is just touched with dirty gloves. Now, that is a big no-no. What you want to be doing is you want that cleanser to be dispensed into a sterile pack so that when the practitioner is touching your cleanser, that it's not being contaminated by a dirty bottle, for example. Other things are, do they have sharps boxes? Do they have clinical waste bins? Do they have general waste bins? Do they have paper towels? Because believe it or not, they shouldn't be reusing hand towels in between treatments. So these are a collection of things that I want you to look for and even think about what cleansing products they're using. to cleanse the skin of your face. Personally, I don't think it's good enough to just give a little wipe around where you've got makeup and leave makeup around on your skin so that they're then going to be touching your skin where there's makeup and potentially transporting any bacteria onto the rest of your face. You want the whole area to be nice and clean before the treatment. And then you want to look at things like accreditation. Are they registered or regulated in any way? Because those regulatory bodies are doing the checks for you, so you don't have to. So they will already check whether or not those hygiene practices in place. They would have checked even staff DBSs. They would, for example, we're registered with Health Inspector at Wales. They check the staff HR folders to make sure that everyone's had the correct training. They make sure that everyone's had clinical waste training and infection prevention control training, and they've had their DBS. There are things like that that are fundamentally really important. So have a little look. For example, Safe Face does a check on us and they do a 116-point check on us, so you don't have to. Now, some of you might have concerns about dermal fillers, and some of them are usually, yes, but will it look natural? I don't want to look over-treated. And I'll be honest, this comes down to multiple things. It comes down to the practitioner. What's in the practitioner's mind? This is why an consultation is so important. Do you agree? Like when you convey your ideas of what you want, does it sound like that practitioner is actually listening to you? And do you know what their plan of action is? Then I want you to think about the dermal fillers that they're going to be using. Now, there are lots of different viscosities and there are different types. So when we look at viscosities of filler, it's important that we use the one that is the correct thickness for the type of result that you're after. So there's no good in us using a very thick filler in your lips if you want a soft and totally undetectable result. Okay, because otherwise it's going to be very noticeable, especially when they're really firm and you've asked for something that's natural. Same goes for cheeks. If you want nice, firm, lifted cheeks, then we don't want to be using a soft filler because you're not going to see it. Now, the same goes for if you want a natural result, we want to make sure we use a softer product that moves with the expressions on your face so that then it becomes an undetectable treatment. So it's not necessarily just down to product, but it's about your practitioner's ability to understand what you want and convey that into results. One thing that lots of people tend to ask is, will it hurt? Now, the key thing is that these dermal fillers come with anaesthetic inside, but that in itself isn't enough. If you're concerned about how it's going to feel, there are some treatments that we do and we make sure that you have a proper anaesthetic like you would at the dentist, so it makes all of the area nice and numb. So for example, if you're having your lips done and if you're having other areas like along the jawline, it might be that you want to come in and have cream applied a little bit earlier in order for that cream to take effect. Now, the best results are going to be if you've got anaesthetic cream on for half an hour before. So at your consultation, if you want to have anaesthetic cream and you want to take it with you and apply it in the areas that we recommend, you can do that 30 minutes before you arrive or before your appointment time. So what you could do is you can apply it just as you get in the car. Let's say it takes you 30 minutes to get here, then that would have taken full effect by the time you arrive, and we could just reapply it then while we get everything ready. Let's look at the recovery time. So recovery time, we need to think about if you're going to a special event, for example, what are the things that maybe you want to avoid? So if you want to avoid bruising, I recommend going 4 weeks before that event to have your treatment. So that allows for any bruising and even residual swelling that lasts afterwards to taper down and just become less and less so that you look your best for the special event that you've got. Then we've got inflammation and redness. And I would say give yourself maybe 4 days all the way up to 2 weeks. It really depends on the treatment area that you're having done. But for example, in the lips, some people swell more than others, and some people can have quite swollen lips for the first 4 days, and then that gradually goes down over a period of 2 weeks. But it really depends. So I would say give yourself, again, at least 2 weeks as a minimum, maybe up to 4 weeks if you're really concerned about any bruising. So if you're considering filler treatment, this is what I would do. I would make sure you get a consultation first, and don't be afraid to go to a couple of places so you can compare. I can't tell you how valuable it is, because then you can see, is that person kind of on my wavelength? Do they get the results that I want? And do I think that I'm actually going to get the outcomes that I'm after? Then I want you to ask your practitioner, what dermal fillers are they going to be using, and what clinical data is available for those dermal fillers? So for example, it's CE marked. I'll be honest, that's not enough. Any dermal fillers can come along, get the CE mark stamped, but what fillers can't have necessarily, if they haven't been around long enough, they don't have enough clinical data, and they haven't been around long enough to prove that they're safe. For example, we use Restylane. And the great thing about Restylane is we know that they've been around for a very long time, and we've got clinical data to prove that they're safe. Then ask about what emergency procedures they have in place, because at the end of the day, this is really important for you to make sure that you're going to be looked after. And lastly, don't rush. You've got plenty of time. I want you to go in for a consultation and then take your time, go away, think about the options, and make sure that you're happy with your decision before you go ahead with treatment. Thanks for staying with us throughout this video. Make sure you follow along, and if you've got any questions, pop them in the comments below.